Hello everyone. In this video, we'll be dealing with thyroid gland. This topic will be discussed under the following aspects. So, thyroid gland is an H-shaped large endocrine gland situated in the lower part of the neck. So, where is this gland located? This gland is located below the thyroid cartilage at the level of C5 to T1 vertebrae, that is the 5th cervical and 1st thoracic vertebrae. It is situated in such a manner that it wraps around the trachea up to 5th tracheal rings. Moving on to its parts, this gland has two lobes, the right lobe and the left lobe, and these two lobes are joined together by a stalk called isthmus, which extends up to 2nd, 3rd and 4th tracheal ring. So this gland has two capsules, namely the true and false capsule. The true capsule is formed by the layers of fibrous connective tissue running along its boundary, and the false capsule is formed by splitting of pretracheal fascia. Moving on to its relation, this is the transverse section of thyroid. Towards the anterolateral position, it is bounded by three muscles, namely the sternohyoid, sternothyroid and sternocleidomastoid muscle. Towards the posterolateral side, this gland is bounded by carotid sheath and its contents. Towards the medial side, it is bounded by two tubes and two cartilages. Two tubes include the trachea and esophagus, and two cartilages are the thyroid and the cricoid cartilage. As you can see in this picture, this gland wraps around the trachea and esophagus and also the thyroid and the cricoid cartilage of larynx. Moving on to the isthmus. As I've mentioned earlier, this isthmus is the stalk which connects both the lobes of the gland. Towards the upper border of this isthmus lies two things. One is the anastomosis of two superior thyroid arteries of both the lobes of this gland, and the levator glandulae thyroidae, which connects the hyoid bone to this isthmus. Towards its lower border is the inferior thyroid vein. Towards the posterior side, it extends up to 2nd, 3rd and 4th tracheal rings. In this picture you can see this is the isthmus. Towards its anterior border lies the sternohyoid and sternothyroid muscle. Next, let's move on to its blood supply. Arterial supply of this gland is via three arteries, namely the superior thyroid artery, inferior thyroid artery and thyroid artery, and its venous drainage is via three veins, namely the superior thyroid vein, middle thyroid vein and the inferior thyroid vein. Now moving on to its nerve supply, it is supplied via three nerves, mainly the vagus nerve, recurrent laryngeal nerve and the external laryngeal nerve. So microscopically, this gland is made up of two cells. One is the follicular cell, which forms the cuboidal epithelium and contains colloid in its lumen. Another type of cell is the parafollicular cells, which is present between the follicular cells along with the blood vessels, nerves, connective tissue, etc. So moving on to its development, this gland originates from the thyroid diverticulum from the floor of primitive pharynx during the 4th week of intrauterine life. Develops from the thyroglossal duct, which originates from the foramen cecum of tongue. This thyroglossal duct later migrates during the 5th week of intrauterine life towards the trachea to reach to its final position. In this picture you can see during the 7th week of intrauterine life, thyroid gland is situated in its final position with the degeneration of this duct. However, a small portion of this duct remains as a pyramidal lobe in the thyroid gland. Moving on to its applied aspects. Due to hypothyroidism, conditions like mixed edema in adults and cretinism in children can be seen. Hypothyroidism leads to condition like goiter, which is nothing but enlargement of the gland. It can lead to difficulty in breathing, that is the dyspnea, difficulty in swallowing, that is dysphagia, and also difficulty in speech, that is dysphonia, or rather the 3 Ds. So this brings me to the end of my video. I hope you found it useful, and if you did, please like, share and subscribe. Thank you and bye bye for now. See you in the next video.